all to the second episodes of Prime Bank Health Talk. Welcome everyone. We know health is wealth, and COVID-19 pandemic has given us an important lesson of cost of indifference to healthcare. There can't be more important things than healthcare and well-being of our family and ourselves. We have to prioritize our health, change certain lifestyle and food habit if we have to survive. In this fight against this pandemic, Prime Bank has been in the forefront of response as COVID-19 disasters unfolded in Bangladesh. Prime Bank undertook large-scale awareness and safety measures since the very beginning of COVID-19 for safety and well-being of the valued customers, employees, and the community. Bank's early response and preparedness were instrumental in running uninterrupted banking operations, even during the government-announced holiday. The farsightedness of the management to tackle the global pandemic has earned the bank the most prestigious international recognition of excellence in leadership in Asia 2020. Prime Bank is the only bank from South Asia to achieve this fiat. It is the intent of care and wellness of the people and community that we are here tonight again in this online health talk. We are joined by three internationally renowned specialist doctors of Manipal Hospitals from Bangalore, India. On behalf of Prime Bank Limited, it is my honor and privilege to warmly welcome Dr. Neha Misra, consultant infectious disease, Dr. Sunil Gurpur Kini, consultant and arthroscopy surgeon, Dr. Vidhyadhara, spine surgery specialist, all from Manipal Hospitals, Bangalore, India. Welcome everyone. Dr. Neha Misra is a consultant with specialty on rare infections such as upper or lower respiratory tract infections, urinary tract infections, abdominal infection, bone and joint infection, infective endocarditis skull-based infections. We have Dr. Sunil Gurpur, who has expertise on hip and knee, primary and revision joint replacement, arthroscopy, sports, and reconstruction. Dr. Vidhyadhara is a dedicated spine surgeon with a special focus on spinal deformity surgeries, minimally invasive spine surgery, computer-assisted spine surgery, artificial disc replacements, and complex revision spine surgeries. He is also involved in stem cell therapy for spinal cord injury and interventional pain management. They'll share important health tips on infectious disease, occupation-related health hazards, lifestyles and food habit, and ways to fight coronavirus and other diseases, and of course, we'll dwell on their respective specialty areas. We also have our Deputy Director, Mr. Faisal from Prime Bank. Thank you, Faisal Bhai, for joining us. It will be an interactive session. We expect a lot of questions from our colleagues, customers, and stakeholders via the social media. The session is being broadcast live on Prime Bank's Facebook page, so do follow the live proceedings. We believe hosting this session in virtual media is the right thing to do at this time of. I'm requesting Bank's Deputy Managing Director, Mr. Faisal Rahman, to say a few words on behalf of the events. Faisal, over to you, please.
Thank you, Najmul. Good evening. First of all, I sincerely thank the panel of expert doctors who have joined us in Health Talk from Bengaluru, India. Thank you. As my colleague Najmul has elaborated in his opening remarks, Prime Bank has been organizing this Health Talk to create awareness in fight against infectious and other diseases. This is second such Health Talk as part of a series that we have planned for safety and well-being of our employees, our customers, and our community. At Prime Bank, safety and wellness of our employees and customers are the highest priority. We have a long history of standing beside our customers and employees and community at challenging times. In corporate Bangladesh, we were one of the first organizations to understand and to undertake preventive measures as early as January 2020, when COVID-19 cases started to surface. The bank undertook large-scale health and safety initiatives, including disinfection drive across the country, protective gears for employees, and strict hygiene guidelines. The bank has strictly implemented no mask, no entry policy at all premises. The majority of employees have been advised to work from home to minimize exposure risk. Its quick response team remains alert 24/7 to assist any employee in case of an emergency. The bank expanded extent of service and encouraged the customers to use alternate delivery channels. This is something we promoted day in, day out, including internet banking platform, ATMs, contact centers, cards to avail necessary banking services without in-person visit to the branches and touchpoints. Once again, I would like to thank specialists from Manipal Hospital, Dr. Neha Misra, Dr. Sunil Gurpur Kini, Dr. Vidhyadhara, who have joined all the way from Bangalore, India. I want to thank our HR, brand, and communication corporate alliance teams for organizing this important session in collaboration with Manipal Hospitals. It will be streamlined live on Prime Bank's Facebook page, so feel free to ask questions. We have the expert consultants with us to respond to your health-related queries. Let me conclude here to move to the main part of the session. Thank you so much.
Thank you, Faisal Bhai, for your very timely message to us. And then I know that you've been very busy and then you just quickly joined us with a very short notice. Thank you, thank you, thank you for coming over. Now, let's move on to our program tonight. In the beginning, as I said, we'll start with Dr. Neha Misra, consultant infectious disease. Dr. Neha, can you hear us?
Yeah, I can hear you.
Over to you, Dr. Neha.
Thank you. So, am I audible?
Yes. Can you speak a little more louder? Yeah.
I'm audible, right?
Sure. Yes, please.
Yes, absolutely.
Yeah, sure. So, good evening, everyone. First of all, I would like to thank Prime Bank and people to provide me this opportunity to get in this time to interact with all the people across the borders and spread awareness regarding this pandemic of COVID. So thanks a lot. I'm Dr. Neha Misra. I'm infectious disease consultant from Manipal Hospital, Bengaluru. So today I'll be talking about do's and don'ts in this era of COVID. And then enough is known and talked about this particular virus. I'm sure most of us know most of the things about it. So I'll be quickly telling you in brief, and then we can move on to the question and answers so that it can be interaction-based talk instead of too much of knowledge outflow from my side. So it's unfortunate that we are in this condition, but we have to survive, and we have to learn how to go ahead and live with this particular condition and without being harmed much, or with most of the precaution, taking maximum utmost precautions and moving forward. Coronavirus is a pandemic that started in December 2019, and currently it has spread it to involve most of the countries, and it has crossed most of the borders. It is there everywhere right now. So it is a beta coronavirus. You might remember that SARS-CoV-1 and MERS, these are the same virus, and this particular virus also belongs to the similar family. When I talk about spread of this virus, how does it spread? There are three basic modes of spread. The most important one being droplet, then second one being the aerosol, third one being the fomite spread. What do I mean by when I talk about these three terms? Basically, when I talk about when somebody coughs or sneezes, a part of saliva the sneeze or cough comes out of the mouth, and it contains viral particles. So these viral particles, if the whole spread thing depends upon size of the particle. So if these viral particles and the salivary drop is less than 5 microns, then it is known as aerosol. Problem with aerosol is it remains suspended in the air for quite long time. The gravity, it settles down really slowly because of it is lighter weight and smaller size. If the size is more than 5 micron, then it does not stay in the air, and it drops very quickly to the ground, contaminating the surface. Now, once somebody comes in contact with droplet or these aerosols, they can get infected. Otherwise, the other method can be when these droplets or aerosol fall on the surface, somebody touches that contaminated surface, these contaminated surface can also spread the infection to the person concerned or whosoever is coming in contact with this particular virus. Now, um, uh, the most important still remains the droplet mode. Touching the surfaces can spread infection, but how viable or how it depends on how quickly the surface has been contacted after this contamination, and how much is the volume of the contaminant over the surface. All these things matter. Plus, the type of surface also matter because viability of virus varies from surface to surface. So right now there is a lot of speculation about whether surface is the best mode. I mean, is one of the most important mode of transmission or not. And since the viability on each surface is different, it still remains debatable how important this fomite transmission is. So the coming studies or coming data will inform us more about this particular thing. Coming to symptoms. So once person has caught this virus, what will happen to them? So after coming in contact with this particular virus, there can be a spectrum of symptoms a person can manifest with. The most important, um, the most, most of the people, around 80% people, is my video not on?
No, it's fine.
No, it's fine. Okay. The most common symptom of the most of the people, around 80 to 85% of people suffering from COVID remain asymptomatic or very mildly symptomatic. The spectrum can increase from something like no symptoms to something like severe breathing difficulty, requiring ventilatory supports. That can be the spectrum. So the most common symptoms which you should watch for is, simple sore throat, cold, breathing, cough, dry cough, wet cough, any kind of cough, fever, body aches, myalgias, rashes, loose motions. These can be common presenting features of COVID disease. Having said that, most of the patients recover without much of the intervention. The importance of realizing that somebody has this particular infection is from the public point of view or from the point of view of spreading disease. So as soon as somebody realizes that they are suffering from this disease, they should isolate themselves as soon as possible so that they are not a risk for people uh, who are living with them or people who are around them. In Delhi, when the infection was at peak, that time they found out that around 95% of the patient had seroprevalence, means they were already having antibodies for this particular virus. That means most of them recover with an asymptomatic infection and without much of intervention or without much of symptoms, without much of problems. They don't even seek medical help most of the time. So if somebody realizes how the infection is, they can actually be managed even at home if the symptoms are very mild. Only few percentage of patients land up with complication. That too, people who have a lot of comorbidities, who are aged, who have diabetes, hypertension, things like that, they only require specific attention and specific care. Otherwise, bigger strata recovers without much of problems. Um, Now coming to the type of treatment required. Treatment can most of the people with mild disease recover with simple symptomatic support. There are no immune boosters. There is nothing that uh, uh, you know nothing that can actually I know a lot of things are being marketed saying that this can boost this immunity, this can help you with prevention of COVID, this can help you with this, but none of the data is actually there to support these things. Immune boosters most of the time is a myth and they don't help much. So the only thing that can help people is the mask, physical distancing, following proper respiratory etiquettes, that is covering your cough, and isolating. As soon as somebody gets to know that they have these symptoms, they should isolate themselves, get tested, and then only they should go out and interact with others. So this is the most important crux of the prevention of spread of infection. So um, apart from that, I would like to finish and give it up to others, saying that probably most see recently we noticed that other diseases like diseases apart from COVID are being neglected. People are getting scared to come to hospital to actually get treated for things which are also equally important. So do I understand that it is very unfortunate that we are into this pandemic. None of the disease is lesser important. So all of the diseases which a person has should be given equal importance. People should seek medical help if need be, and they should come to hospital. All the hospitals currently are taking enough and due precautions to prevent spread, to prevent others from getting this infection. So don't neglect any other disease. COVID, it's not going any soon. So we should learn to live with this. We should learn to how to uh, give importance to this as well as other things. So stay protected. That is very good. That is important in current scenario. But don't become paranoid about it. Take due precautions. It is of utmost importance. But then don't ignore any other illnesses as well.
Thank you, Dr. Neha, for your wonderful deliberation. It's a great beginning, and I believe that our followers and also the employees who are very inquisitive and have a lot of questions, they have actually got a good understanding of how to look at the prevention rather than the cure point of view. So at this stage, I'm requesting Mr. Sunil Kini to speak briefly on our today's topic, where we are going to cover on the lifestyle management in COVID time. Dr. Sunil, over to you. Sir, can you unmute yourself? Yes, it's still, you are mute.
Is it okay? Am I audible now?
Yes, absolutely.
You just want me to talk through, or you want me to share a PPT and then talk?
No, absolutely. It's your convenience. I mean, whatever way you want. Yeah, PPT is fine. Sunil, you have to open the PPT at first, then you need to share the screen. That will work that way. Yeah. Yes, it's visible.
Yeah. The screen is visible?
Yes.
Yeah, hi. Hi, very good evening. And first of all, I would like to thank Prime Bank and Manipal Hospitals for the opportunity to chip in with our experiences during this COVID-19 pandemic. It's unfortunate, but it's been there for some time and probably continue to do so, as Dr. Neha already mentioned. So here are some of the tips probably which I could offer from my side regarding how to live with COVID and how we at Manipal Hospitals have been managing with patients throughout the pandemic. So I think the most important challenges that we face as human beings are these three. One is to ensure that there's good physical well-being, good mental well-being. A lot of discussion on that being done nowadays, and social well-being for us to sail through this phase. When we say physical well-being, There are some points which I've highlighted, which probably makes a lot of sense. One is to set a good routine. So it's very important to make sure that once we stay at home and not working anymore, there's a good chance that we'll lose our routine. So please stick to your daily routines, whether it's sleep, whether it's work habits, or whether it's recreational times. Point number two is to absolutely have a good mix of healthy and regular food habits. When I say food habits, food which is low in carbohydrates, low in salt, low in sugar, and rich in antioxidants, vegetables, fresh foods, not stored foods, and always consume hot stuff. Some antioxidants which are known to us are like turmeric and garlic, which is helpful. So immune boosters or supplements, vitamin C, available plenty in fruits, vitamin D, sunlight, zinc is one of them. Get enough sleep. Make sure you have at least 7 to 8 hours of sleep, because that's the time when you actually regenerate and yourself, and immunity boosts as well. Make sure you're adequately hydrated. Exercise and yoga make a long way in this. Do not skip routine medications. We see a lot of patients, even in our orthopedic and practice, there who skip medicines, and some conditions, especially arthritis of the inflammatory type, we see that once you skip there's a flare up of these conditions. And maximize productivity from home, and always this is the best time probably to try a new hobby which you may be good at and can excel as well. Mental well-being, it's very important to be in good health. A lot of cases of depression are being spread through this pandemic. So you have to practice mindfulness. So that means that you have to be absolutely aware of your surroundings and what is going on. Any latest information about COVID, healthy information should always be spread, and breakthroughs should be appreciated. So breathing exercise, meditation will definitely help. Mindful use of social media. Nowadays, everywhere on social media, you hear a lot of things on COVID, and many of them are in the negative sense. So stop sharing them, and you have to use it mindfully. And always have empathize, and don't stigmatize patients, especially who are COVID positive patients have recovered. So they are as good as any of us. Social well-being, it's very important in today's day to stay virtually connected. And we do so through this webinar as we speak, and share information as well. Talk to people. There's a very good chance to get off electronic media and also get good connect with people, with all maintaining all the social distancing as well. Educate children, reduce screen time, and be a positive influence on social media. So coming to from the general to the orthopedic purview here, through this pandemic that started mid in March, the orthopedic cases we have seen the clinic, or which is expected to increase, are the following. Trauma. So trauma, more of elderly people, because people are not actually venturing outside. So your road traffic accident actually reduces. But what increases is the history of fall at home, especially in the elderly. So geriatric orthopedic plays a very important part here. History of assault, probably people staying at home for a longer time, there's obviously more chance of falls and assaults. And progression of condition. A lot of patients who are already in advanced cases of orthopedic conditions like arthritis or conditions like that may progress. And so it's very important to keep a check with the doctor regarding your present condition. Spine, Dr. Vidhyadhara is going to speak about. A lot of patients come to us with neck and low back pain, probably because a lot of people are working from home. So without proper ethics, or without good back care. So it's important to recognize this condition as well. A lot of us had post-operative cases who used to come for us dressings, and as I said, elective cases with severe symptoms. From our end, from the orthopedic department and from everyone at Manipal, we have worked all through this pandemic, but we had made slight changes in the sense that we had restricted our practice to only emergencies. In orthopedics, that means fractures or open injuries or dislocations, which have to be treated at any point of time. So initially, we made a team approach to make sure that the number of people coming to the hospital had reduced. So we had doctors who were working in tandem. Every week, we used to change ourselves to reduce our exposure to these COVID cases. But from the past 6 weeks, we have been working extensively. We have restarted all our elective surgeries like joint replacement and arthroscopy and sports with good precautions being taken. So we make sure that in the hospital, we sanitize everything with the necessary disinfectant. We make sure that all healthcare staff, especially within the emergencies, have personal protective equipment to their disposal, because you never know. The emergency is the point of entry, and a lot of patients may be COVID positive, so they should take utmost care. So I would rush through this slide. Um, so from the outpatient clinics where we practice, we've got dispersed seating arrangements to make sure people have maintained social distance. We have one attendant per patient. We make sure all doctors, patients obviously wear masks and practice hand sanitizer, which you see at all stations. We have a separate fever clinic for suspected COVID patients to make sure that we do not mix them with our regular patients. And we also have been encouraging video consultation all throughout, especially for new and our follow-up patients who should not miss on these chances. So the protocol for at least orthopedic surgery, I can say, is to do a COVID testing as of now for all patients who do come for emergency surgeries. We do a COVID rapid antigen test, which results are available in a couple of hours, and then we can take them up for emergency surgeries. For patients like joint replacements and keyhole arthroscopy surgeries, we do a COVID RT-PCR. The results are available by 18 to 20 hours, and then we take them. We always take the help of our specialist whom we just heard, Dr. Neha, who also help us and advise us from time to time. And for patients who are actually in suspect cases, we have a separate COVID ward, a separate entrance, a separate lift for that. And we don't mix up the patients. And all these patients with suspected or a COVID positive patients are operated in a separate operating theater and are not mixed with the regular normal patients. So we do a risk stratification, as I said. I would not go into the details of that. Of COVID positive and negative patients. Similarly, in the operating room, we make sure that there are minimal people in the traffic in the operating theater. We all wear what we call as respirators to protect ourselves and the PPE if needed. I won't go into the details. Again, post-op, we make sure that we all have isolation wards for COVID positive patients. So there never a mix-up all through from the admission to the surgery. And we take adequate precautions that way. So a couple of cases, I will not go into the details, which were operated during this COVID. 6 weeks back, one was a trauma patient who had a dislocation of the knee for more than a year. This patient was from Bangladesh. And then after the preliminary treatment, we did a complex knee replacement, what you can see on the right side. And patient who could not walk is absolutely able to walk with support and able to bend the knee. And he was a happy man. One of the other patients was a hip replacement patient who had multiple surgeries for his hip, the hip dislocated, and as you see on the right, we had to do a revision hip replacement in these cases. So I'd like to end my talk. That's our hospital on the left-hand side. It's a place where we work, the main Manipal Hospitals in Bangalore, and on the right is my card. So if you have any queries later, even on after the talk, you can always contact me or mail me at the website or the address mentioned below. Thank you all, and stay safe.
Thank you, Dr. Sunil, for your very important deliberation. We have been receiving a number of questions, basically, and I'll come back to you on this. But there are some questions very specific for you and also for Dr. Neha. So now let's hear from Dr. Vidhyadhara, who is going to briefly talk about the topic of tonight, lifestyle management in COVID time, and also cover the area of his specialization. Dr. Vidhyadhara, it's over to you.
Good evening, sir. Am I audible?
Yeah, please. Yes.
Yeah, so I think I'll get away from COVID because both of them have covered both non-medical stuff as well as how we take precautions in doing surgeries and how we have bounced back to being normal. I would go through quickly one of my presentations on back pain, which is my all-time favorite. I think Ram will be bored to listen to this again. But having said, who doesn't have back pain? Whether you are in the middle of a pandemic or no pandemic, every one of us, at least 8 out of 10 of us have back pain at some point of time. And in a place like Bangalore, where most of us are doing sitting job, it's a major epidemic. It's a big business as well because anything and everything can be sold in the name of back pain, whether it's beds, liniments, herbal remedies, or even surgeries. And a lot of myths around saying that lifting heavy objects causes back pain or bed rest is the best way to cure a bad back, or MRI always identifies the cause of back pain. And once back pain, eventually you need surgery. All these are false. But the fact remains that many people suffer from back pain and no two doctors talk the same language. You go to 2 doctors, you'll get 2 opinions. You go to 20, you'll get 20. But what is the truth? The truth remains that many of us suffer and there is no standard of. Now, these are the spinal bones, what we call as vertebrae, and there is an intervening disc or a cushion, because hard surfaces, otherwise there is a lot of rubbing or shocks. To prevent that from causing a lot of friction, there is a cushion. There are two joints behind which give us the movement. This is called as functional spinal unit. And there is also ligaments in front, the muscles behind, which contract and relax so that your back and neck moves. There is a delicate spinal cord going from the brain to the tail tip, giving branches at every level and going to the upper limbs and lower limbs. What goes wrong? The kingpin maker in almost any and every problem with respect to the neck and back is the disc. The disc, to begin with, when we are born, is liquid in consistency. With age, it becomes jelly, it becomes solid, merely because every tissue of the body loses water and proteins. And thus, this process is called as disc degeneration, and it causes either neck or back pain. Now, this is a schematic diagram of a disc in a child. Two bones separated by a balloon filled with water, mouth tied. It's a very good shock absorber. As we grow adults, the balloon becomes thicker, the water becomes lesser. This is a lesser efficient shock absorber, and this can tear. Although it is thicker, but it is stiffer and it's more prone to injury. And then the liquid inside, that is the liquid nucleus pulposus, comes out. It causes either mechanical compression of the nerve root going down the leg or arm, or chemical irritation of the nerve root going down the leg or arm. And in addition to back pain, the patient gets leg pain, what we call as slip disc or the disc prolapse. This is also quite common. Half the population will suffer from back or neck pain along with arm or leg pain at some point of time. Friends, this is the MRI of a 10-year-old child done for academic purpose. He doesn't have any back pain. And at 80, the same child will have this kind of a MRI, all dehydrated disc. You can see watery balloony discs, and here it is all degenerated, totally dehydrated discs. Given time, every single disc will go through a degeneration, then the disc will bulge. From above down I am going. The disc will tear, the liquid will come out, the gap between the two bones becomes less, and then they start wobbling, what we call a stage of instability, and then the bones bridge across the disc and form a spondylophyte, what is called a stage of self-stabilization. So there are three stages that every single of our 33 discs have to go through: stage of degeneration, stage of instability, and stage of self-stabilization. And if you don't go through all these three stages, you are superhuman. Now, coming quickly to how we suffer. Now, every one of us don't like back pain or neck pain. But friends, pain is a protective reflex in response to an underlying physical injury, and we respond to it by a psychological expression. This is number one. So it's your friend, it's not your enemy. Pain says that there is an underlying injury. It is not bad to have pain. Otherwise, you don't know that you have injured your back or neck, and you will injure it more. So pain is good. It is your friend. Change your thinking about pain. Now, what is bad is the stress. Stress is known to amplify pain and also complicate pain. When you are in stress, under stress, you will feel the same pain much, much more than when you are happy. And any extreme of emotion causes stress on our body. Now, all of us wanted to be doctors, wanting to treat patients. But you know, after becoming a spine surgeon, now finishing 20 years, it's so ridiculous that everybody explains to you all different words for the same pain. And you know, you get bugged saying that, sorry to say, but you know, they still feel after 5 minutes, 10 minutes explaining the pain that, doctor, you really are not able to understand my pain. It's so severe. You know what I mean? So, but we all look for red flags. Children usually don't have back pain, and elderly don't come to us without any severe problem. That's why we say if a child comes on or an elderly person more than 50, 60 years, it's a red flag for us. If an elderly person on steroids or somebody with cancer falls down, even in the bathroom, prone for fractures of the spine, and we take it as red flag. Tuberculosis of the spine has come back with a vengeance. We see at least 4 or 5 cases every month. So if somebody has back or neck pain along with fever, loss of weight, loss of appetite, we think of tuberculosis. And obviously, if there are tingling, numbness, weakness of limbs, it is a definite red flag. 90% of back pain, neck pain becomes better on lying down at night and on taking painkillers or analgesics. However, if somebody says he or she is not able to sleep, it is not getting better with painkillers, definitely we think of spinal infection or spinal cancer. Quick examination which you can do to see whether you want to go to a doctor or not. If you look at yourself in a long full length mirror, see whether you're walking normally. If you're able to walk on both your heel and walk on both your toes, I think you're fairly okay to wait. If you're not able to do one of the three things, if you find it difficult, please see a doctor immediately. Now, not many of the patients, like 99% of patients, don't have any red flags either on history or in examination, but they all have back pain, and it is a serious stuff because they're coming so far to see you to get an answer. Now we have so many tests in the market that we can exhaust anybody's bank balance. And to add to our confusions, patients come and tell that doctor, 1995 I was diagnosed with spondylosis, or I had a slip disc in 2011, I had an extra bone crack in the back, because people like me would have shown it on the MRI and X-ray and told that, see, this is your problem. And we may see also that there is an extra calcification of the disc, or there is a defect in the bone, or there is an extra piece of bone here, a triangular piece. There are irregular bones on the X-rays, but these need not be the cause of back pain. Who knows, the patient's grandfather also may have had this problem, but he never had a big problem because he didn't have time, he didn't have money, he didn't have doctors like Vidhyadhara, he didn't have technology like X-ray and MRI. So he lived happily, the grandfather lived happily till 1890 without a big problem. Today, we time, money, doctors and technology. We go searching for problem, and more we search, more we get scared. Now, this is an interesting study on MRIs, on the back pain expenditure done by the insurance companies in the US. 10 years analysis, they found from 94 to 2004, the insurance companies spent nearly 5 times more money on MRIs, nearly 2 times more money on painkiller medications, 4 times more money on spinal injections, and 5 times more money on doing surgeries. But their baseline remained that these increased expenditures over a period of 10 years were not accompanied by improved patient outcome or patient disability. So they did more analysis as to what is going on. They found that 2/3 of the spinal MRIs were inappropriately being asked, and that spine surgery rates were highest where the imaging was highest. So friends, I always tell patients, safeguard your interest. It's your blanket. You need to see that you have the blanket. Doesn't matter who is sleeping next. So should you even do an X-ray when you have acute back pain? Obviously the answer is no. When do you need X-ray? If it is a child with back pain, definitely do it. If severe back pain in an elderly, please do it. Incapacitating, somebody is not able to get up, coming on a stretcher, please get an X-ray, or somebody has met with an accident on the road, please get an X-ray. The rest all people can wait for at least 3 weeks or see if they develop a deformity, and then they can do an X-ray. X-ray mainly excludes bony pathology. Now, MRI is the gold standard diagnostic tool for any and every problem in the spine. It can show a small degeneration protein from the disc to a large slip disc like this, or a bone slip like this. And even it can diagnose infection and malignancies, that is cancers in the spine at the earliest, even before any other test would pick up. So MRI is, that's why called as gold standard. But having said, this is a very important landmark article by Eugene Keregi from New England Journal of Medicine, which is like having an article in this kind of a journal is like getting a Nobel Prize for a spine surgeon. So he put a small advertisement saying that if you are having no back pain, never had back pain, you come to me and I'll do a free MRI. I'm sure all Indians in US would have gone there, and he got 1,470 normal volunteers who had never had back pain, and he did an MRI to study what is normal in somebody who never had back pain. This is the MRI picture that he collected, and these are the line diagrams. You see, he saw that people who were normal volunteers, mind you, not patients, had slip disc, people had Schmall's nodes, people had disc degeneration, loss of water, and people had annular tear with high intensity zone, the balloon rupture and the liquid coming out. Can you see here? And this is the graph, the result that he showed. Out of 100, 60% of normal people had disc degeneration, 55% had slip disc, 30% annular tears, and 25% high intensity zone. So he concluded that if you are going to treat the MRI, you are like this hunter who is hunting for his prey. And if you want to look at the MRI and treat a patient's symptoms, every level looks abnormal. You are like this lineman who doesn't know which wire is faulty. Friends, we don't know. This is exactly how I depict. If you have back pain, you going and seeing a doctor beforehand, like in a hurry, is like trying to save yourself, thinking that either yourself or somebody else, and you don't know what is waiting for you. Now, basics of treatment, I divide it into two parts quickly in just next 5 minutes. Treatment when there is pain, obviously all of us will follow because pain chases you from behind. Prevention is when there is no pain. After 3 months, you will forget. After 6 months, even wife will stop nagging you, saying that you had back pain and you have to do this. Now, these are not no offenses to anybody, but after all the advances in science, we today believe that it is the nature which heals back pain and neck pain, not the doctor, nor the physio, nor the painkillers, nor the belts, collars. No, it's the nature which heals. It takes time. It takes up to 3 months, and 90% people become better on their own. But how many of us have patience? Of course, there are two big problems. There is no patience in us, and there are too many options. Every main road has a hospital. Every small crossroad has a diagnostic center. So we go changing doctors and hospitals till such time that the nature heals and the last doctor gets the credit. Friends, bed rest for back pain is not good. More than 2 days, if you are lying on the bed, it delays recovery. All these are evidence-based guidelines. It's not from Vidhyadhara. These are proven beyond reasonable doubt. Wearing belts and collars is not good for the back. And no physiotherapy, in fact, improves. It only gives a pain relief. So what to do, what not to do? Every one of you will get to hear people's advice, whether they know anything about back pain or not, but they would tell you what to do, what not to do. But most unfortunate thing is everybody will tell you, don't bend, don't sit, don't go on two-wheelers, don't. There is hardly anybody telling you what you should do. So friends, resume normal daily activities despite pain, but don't do something that increases pain. So who has to decide? You need to decide. When you have pain, your pain will be the guide. So it is protective. It will tell you what you can and what you should not. So rest, friends, is equal to rest. Today we believe in active rest. And painkillers, as the name says, should be taken only when you have an important meeting, your boss has called you, or you are going for a wedding reception. Please do take a painkiller, otherwise the album will get spoiled. Friends, antidepressants, especially in people between 20 and 50 years age, wherein lot of stress element is there, which is affecting their back pain, has been proven to be definitely beneficial, more than the painkillers. Now, after having said, what do we do? What is my job? I also do surgeries, but it's only when you have pain with weakness of limbs or loss of control of urine and motion. This is when it is an absolute indication for surgery, because here the nerve is pressed so hard that the limb is stopping to function or the urine motion control is lost. And that's where I, as a surgeon, have a right to sell surgery. And here time is money. The earlier I operate, the better it is with respect to neurological outcome. Rest all patients have to wait. If you don't have weakness, don't have gallbladder involvement, you please wait for 3 months before seeing the doctor. But after 3 months, it is not advisable to wait if it is functionally disabling. What is functionally disabling? It depends on each one's expectations and ability. If you think you are not able to bear with it, it's more than 3 months, please see a doctor and see if you can get rid of it. But here, I don't decide. It is the patient who has to buy surgery, because it's a relative indication. As you know, pain is a very subjective feeling. It is not feeling. There is no measure for pain. My pain and your pain may be different, but it is severe pain. So we say it is the patient who has to decide, and at least there should be a suffering for minimum of 3 months, so that we have given enough chance for nature to heal, and it doesn't heal, and then you take surgery as the last option. But not to say the least, spine surgery, friends, is not a cosmetic surgery, not to make the disc which is bulging or protruding to trim and make it less. Natural history of neglected back pain, it is episodic disease, but episodes will keep coming more and more often, and after a while the recovery from the episodes will become lesser and lesser, leaving behind a residual pain. Now, if you are looking at preventing, you have to start something here so that the episodes will not come again. Friends, our body is flexible when we are born, and it becomes stiff as we grow. It's not because our liquid disc becomes solid, it's merely because of inactivity of, you remember the first picture that I showed, ligaments in front and muscles behind. If they don't move, these become stiff and then the disc will tear or prolapse and you'll get back pain and leg pain. So if you want to prevent, flexibility is the key. You need to reverse. And our body, friends, is like this car. If you don't start it every day, you have to push and start. After a month, you have to change the battery and start. Friends, although we, the human beings, have, to our credit, that we were the most evolved animal on planet Earth by virtue of us being able to stand totally erect against gravity. Chimpanzees came near to us, but never so straight. But look at us, we are regressing evolution. Friends, one of the most important preventive measures for back and neck pain is yoga and pranayam. Few lifestyle things: quit smoking, avoid weight gain for obvious reasons, and sit straight, look straight. But more important than that, especially in a bank like you, take breaks. Not coffee, bhaji and cigarette break or BD break. Get up and walk, do some stretches, drink water and come back and sit. Friends, movement is life, whether it is heart, lungs or spine. Movement is life and you're not made by God to sit and work. And don't do MRI unless indicated. It's one of the very important preventive measures. Friends, this is a paper on yoga which says that yoga in chronic back pain improves functional disability, pain intensity and depression in adults with chronic low back pain. You know, it also tackles both physical and psychological arms of pain, which is very important. And yoga, friends, is like a recurring deposit. You invest every day 1 hour of your time on doing yoga. It's a way of life. It's not an exercise, and it has to be done when there is no pain. Friends, some pearls in whatever I talked, it is not because this bulge is small that you don't need surgery. Even in a narrow canal, small disc may be such a nuisance that you may end up doing surgery. Or it is not to say that because it's a large disc that you need a surgery. No. So many times the canal is wide and it may be freely floating without symptoms. So you don't have to go in and do a surgery. Surgery, friends, no matter whether it's Manipal Hospital has no success rate of 100%. If somebody says that they are 100%, they are lying to you. Conservative treatment doesn't matter how long it is, but it's reversible. Surgery, no matter how small it is, it will always leave behind a scar. Friends, think conservative, stay conservative. I don't mind you doing thorough workup to rule out infection and cancer, but don't get over-treated. Surgery only if you have weakness, bowel bladder involvement, or if pain is more than 3 months. Everything else is non-surgical. In one slide, if I have to summarize, friends, pain is protective, respect it, be within its limits. Flexibility is the key. Maintain it with yoga when you don't have pain. MRI and surgery share the common indications. Do it only when it is really genuinely necessary. Rest of the people can be managed conservatively, but to not say that you have to live with back pain forever, it then becomes a chronic back pain syndrome, wherein it can only be intermittently treated but rarely be cured, like your diabetes and asthma. Friends, there is no Viagra which can reverse these changes in the discs that are happening. And on a philosophical note, I'll end this talk. God wanted all of us to be like farmers like this, sweat it out in the hot sun. End of the day, any food will taste nice, any bed, any mattress, no bed, no mattress. He'll get a good night's sleep. And no matter what he has earned the previous day, when he gets up the next day morning, he is fresh, energetic and happy. Today, what we do, sit in air-conditioned rooms, our brain is heated, body is cold. Exactly reverse of what God wanted, and our body reacts. There are expressions, somatic expressions of stress disorder, like headache, chest pain, palpitation, breathlessness, acidity, neck pain, back pain, menstrual irregularities. You know, all these are somatic manifestations of stress disorder. And if you come to Manipal Hospital, we have symptom-specific doctors like Vidhyadhara. There are 250 of us, and we can make you a patient. So friends, there are 3 choices for you. One, if you want to do a sitting job, like a banker's job, you have to do one of these 3. One, go back to your grandfather's farm, do agriculture work, not supervising, doing, dirtying your hands. If you don't want to dirty your hands and legs, do 1 hour of yoga. If not both, stop cribbing, start enjoying pain, and keep changing doctors for entertainment. On a serious note, I feel we are over treating back pain, neck pain, and it's time to back off. On one line about COVID, I think the earlier we learn to live with it, with all the safety, I think the better off we are, because running away from it is not an option. it is going to be with us for the next 1-2 years till vaccine comes and it shows the effect. Till then, I think we have to save ourselves, and it is individual responsibility. Neither the bank nor the nation nor the state is responsible for our making. Thank you, one and all.
Thank you, Dr. Vidhyadhara, for your wonderful deliberation. There were a lot to learn, and as I said, that this event is live streaming from our Facebook page. So, Banks has got more than 500,000 followers who are watching this event tonight with us, and also we have our more than 3,000 employees who are also watching it live. Uh, Now, as we are very fortunate tonight to have the doctors from different area, so we will not limit our discussion only within the dialogues for COVID, but definitely there will be the emphasis, because the questions that we have already received in our Facebook page and also from our colleagues, that also very mix of questions from regarding how to combat against COVID, and also a little more about your specialist area. So just to begin with, the discussion is very open, because I'm now moving into the Q&A session, where the question that I have received, the one that actually came or being asked again and again is, now since the holidays are over, or we started going back to our workplaces, and we observed that a lot of people are now are in the street or in the markets, and also they're also started going to office. A lot of them are probably attending 5 days a week, and a lot of them are probably in a little bit of 2 or 3 days. But it's, and also because of the mental situation, we also observe that people want to now go out. So once they're going out and being at the open market or at the outdoor spaces, most of the questions are being asked here, what are the guidances? What do you think that what we should be following once we are back home? Because at home we have our elders and also the children, and they're probably not going out, but and we have to go out for different reasons. So what sort of guidance you have in terms of once we have started going to outdoor spaces to manage COVID at this situation? uh, I mean, it's open to any of you. I mean, if feel free to, chip in, whoever want to. Yeah. Sunil, would you like to go on? Yeah, I mean, you can unmute yourself.
Yeah, like to give an analogy, we all have been working all throughout the, pandemic, going to hospitals, so high risk places actually, and till now we managed to stay safe. Probably the golden rules still remain the same. One, two, three. One is obviously you have to wear a mask whenever you go out. We know that nasal route is the commonest route, especially the aerosol route. So always wear a mask for anyone who wants to leave home. Doesn't have to be N95 mask. Even a good cloth reusable mask is also good enough. So that's number one. Second one is to maintain social distancing, which is absolutely important. So at least 6 feet distance in between people to make sure that there's no spread. And it's the best result is when both of you, when you're talking to anyone, both of you wear masks. That's the maximum benefit. If one person wears and the other doesn't, so that doesn't really work out. So wear mask. Make sure you sanitize your hands all the time as far as possible, and don't touch your nose. So obviously, wearing a mask, you wouldn't do that. And to be frank, closed spaces are more of a risk than open spaces. As you said, open spaces are slightly lesser risk because of circulation of air. So don't deter yourself from not going out. I mean, you go obviously only if it's absolutely necessary for your course or for people going back to work. But these three norms must be, always followed. One is, wearing a mask, hand sanitizing, and maintain social distancing.
Thank you, Sunil. I mean, just to reiterate the fact that, yes, I mean, it's very important to wear a mask, as you said, but we also observe that there is a lot of us are also using gloves whenever we are going out, especially in the public places. And there is a confusion that whether we have to wear it all the time, or is it safe to use it? what do you think? I mean, what's your advice?
Yeah. So wearing gloves is obviously good, but that's for people obviously uh, people who don't wear who wear gloves is to make sure that you don't touch it all the time. But even if you don't wear a glove, I think it's still all right as long as follow hand sanitization rules. So that's not an absolute must, but it's always all right to wear gloves. So it's readily available. So why not?
All right. Thank you. Is Neha there? I mean, there's a very
Yeah, yeah,
specific
I'm
question
there.
to Neha.
So the
Uh,
yeah, I'm there. So
yeah,
the
would you
thing is,
like to add?
yeah, little bit addition. See, WHO says that it's not necessary to wear gloves. Uh, Wearing gloves doesn't take away the need to wash hands. And if you are wearing, it is good to wear, as Dr. Sunil already said. But then you should change as soon as you touch some contaminated surface and wash your hands. So I feel for the general public who have limited understanding of which surface can be contaminated, and when you're going out, when you don't know which particular area can be more infected and all, then it's better to wash your hands frequently rather than rather than wearing gloves, because that can create a confusion. You can still get infected while removing it wrongly. Somebody can touch the surface and touch your nose thinking that or face or some other part thinking that they're protected. So that might create a false sense of security, I believe. So using it, until and unless a person knows how to responsibly use the glove, they should try not to wear it and stick to hand hygiene is what I believe. But
Thank you.
if they understand the need, then they can use it. Go ahead and use it. It's good.
Right. Thank you. I mean, but there are also situations where many of us are also using public transport,
Hmm.
or and also there are a mix of, colleagues where some of us are probably using our private car to come over to office, or many of us also have to use the public transport. So in this situation, how would you think, I mean, to be safe from the infections when somebody's in the office or coming back home?
So wearing, if you're using a public transport, I would suggest, if you can follow the three things that Dr. Sunil said. Maintain adequate distance, that is important. Wear your mask all the time. Everybody wearing mask diminishes the risk of transmission less than 1%. So that is very important, wear the mask. Then if you are touching some contaminated surface, then wash your hands. If you're coming from outside and you're entering your house, try following proper hand hygiene, washing your hands for around 40 to 60 seconds, and with either alcohol based solution or soap and water if available. These things remain the most the crux. They remain the mainstay of infection control in current situation. Yes, gloves you can still wear. If you're worried in public transport, you can still wear it if you want.
Thank you. I mean, another questions that Sunil, would you like to add
I want
something?
to add one thing. We see a lot of patients even in India. They don't wear the mask properly. They wear it below the nose, so that it doesn't
Yes.
really work. So it's very important that the
Right,
nose
right.
should be covered.
Yeah.
Very, very important.
Yes.
Right. And we also often observe that while having a conversation with another person in the room, probably somebody just take off the mask. So, I mean, wherever you wear it for throughout the day, I mean, if you just practice that thing, that's a wrong practice, which is probably wrong.
And not only that, especially, I mean, if you're in an office, especially during lunchtime, there's a tendency that all of you sit down as a group together, take off your mask. And that probably is a time wherein it can actually, so you have to be careful during those.
Right. I mean, another questions I like when we were running our first episodes, we have also, heard the same issue that cleaning the food items is something which is complicated, because once it's the grocery stuff, which is a dry item, you probably could possibly clean it with more care. But when it comes to food, let's say vegetables or the baby foods or fruits, there's still a confusion that what's the best way of cleaning it. I mean, to not to get infected by the virus. So the first question is how long it stands on the surface of vegetables or fruits, because if you clean it too much, then you probably lose out on the value of nutrition. And also if you clean it wrong, then you probably would be is making it more messier. So what's the advice from you?
See, there is very less information about whether food item can spread the virus. So considering it as always infected is wrong. Wash your hands prior to handling your food and vegetable. That is enough. Washing the vegetable normally under running water is again sufficient. So there's no need to consider any fruit or any vegetable less or more infective than any the other one. So just normally, as you wash your hands before touching the fruits and vegetables, wash them under running water as you usually do, and then they are good to go.
Okay, so can anyone who is already infected by coronavirus and being recovered, and is there any opportunity or a situation that that person might be infected again?
See, the information available about reinfection is very minimum. Uh, as we know from the previously existing coronavirus, reinfection with the coronavirus or any flu virus is still a possibility. But then, how long the protection given from one particular virus stays, and how protective are the antibodies that are generated in your blood after one particular infection are, we still don't know much about it. So reinfection still is a possibility, but when and how long, we don't know. We still
Thank you.
have to learn.
Thank you. I have a very specific questions. I'm not a doctor, so I'm still going to ask. Please help me. I mean, once to like compose it if it's needed. There are two questions about PLID. That in case of PLID, what is the proper treatment? So I'm not too sure about what's been meant as PLID. So the person who needs the treatment for PLID, that person should be going to the medicine specialist or to the physiotherapist or to the surgeon.
I think
Yeah.
Dr. Vidhyadhara can answer.
Yeah, so PLID is prolapsed intervertebral disc prolapse. So basically, it is an MRI diagnosis. So if you do an MRI, you'll always see that there is a disc which has slipped in case there is a person with back pain going down the leg. Now, like I said, the treatment is first is time. It takes time for a intervertebral disc prolapse to heal. It is immaterial whether a physiotherapist treats, physician treats, or a spine surgeon treats. It needs time, and you need to treat symptom. There is no cure that anybody can give. It is the nature which has to heal. It takes time up to 3 months. Now, during this time, you have to be within pain limits and do everything. It is not necessary that every day you have to spend 1 hour going to a physio. But having said, there are pain relieving medications which make your life more easier. And secondly, you have injections like epidural steroid or a transforaminal nerve root block, which can reduce the pain so that you can function normally at the earliest, because bed rest is out of style, out of scientific world. More than 2 days, it actually does bad than good. So it doesn't matter whom you go to. If you still don't have pain relief after 6 weeks, I think you deserve to get an MRI and a root block. And if after 3 months it doesn't get settled, even with whatever you do or don't do, and then you may need a small surgery to rectify the problem. It is basically a layman's term for PLID is slip disc. Am I clear?
Yeah, sure. Uh, we are also often coming across another rumor that due to the outbreak of coronavirus across US or the countries where which is more of winter prone, that is coronavirus is more contagious during winter than summer, because winter is just approaching. I mean, and in few months down the line we will be also having winter. So is it true that coronavirus is more contagious during winter than summer? I mean, any clue?
Okay, so there is very minimal data suggesting that, but to say that very confidently, it needs more studies to be published. But then there is some data suggesting what you are saying. Yes.
All right. So, I mean, do you have any specific recommendations that once we will be like during winter that we need to be more careful or take
No,
more
no,
preventive
no, nothing.
actions?
No,
Is the
that
same.
is not, no, it's the same. The things remain same. There's nothing specific to be done depending upon the season. Nothing specific.
All right. All right. We have received quite a number of questions regarding spondylitis. Uh, First of all, the question being asked is, as long as you have already discussed about the back pain, there are also the situation is happening where a lot of people are working from home, and spondylitis is something that they're also observing. So, what are the main causes of spondylitis, and what's the best treatment or the cure that you recommend from your perspective?
Yeah, I'll take this. See, basically, like I said, sitting is not good for human beings, and especially more so now at home. I think you are more used to sitting because even after the work is over, you're still sitting and watching TV, sitting and having dinner, lunch. So everything is sitting, sitting, and sitting. So for preventing this, I think yoga is one of the best things, especially the Surya Namaskar. Even your namaz is good, but it's only forward movement. I think you need equal amount of backward movement and in sequence. And there is a breathing pattern along with the postures that you need to adopt. So if you learn it from the best of yoga therapists, I think it will do good to you in the long term. If you cannot do that, at least next best is swimming. But I don't know, you have a lot of reasons not to do it because one day you'll feel it's cold, one day it is. You may not have the facility of a indoor swimming pool, heated swimming pool. So it may be raining, you may have gone to your native place. So lot of stuff which can make you not do it on a regular basis. So exercise on a regular basis does help. Also, a lot of people have of late not been going out in the sunlight because of this COVID fear, and they seem to be having vitamin D deficiency. And always you check your levels and supplement vitamin D, exercise, drink milk, take breaks while sitting job, do some stretches, drink a lot of water. I think everything helps. It's just a body mind synchronization. Body has to be more physically active, less mentally, and we are doing the opposite. I think that's what is. Spondylosis is a very vague term given to all the neck and back pains. It has no specific definition as to this is spondylosis. And in X-ray, if you see a reduced gap between the two bones, we call it as spondylosis. But if you do an MRI, there is a disc bulge. All these are different photos taken in different cameras. You know, ultimately it is back pain or neck pain. It is just because of your lifestyle, and it has nothing to do with the disc bulge. You have people with even slip disc having no symptoms because they may be having a very flexible body, very good mobile nerves, mobile muscles, which don't break often. And I think that is more important to prevent than treat. Treatment anyway is wait and watch for the nature to heal. And if it is not healing, maybe an injection. If it is not settling, maybe surgery. So meanwhile, some symptomatic relief with painkillers on and off, and some physiotherapy on and off, but not on a regular basis for years and months together. I have seen people who do physiotherapy for 6 months, 1 year. I don't know how they can afford. I will lose my job if I go so much out of work.
Thank you. Thank
Yeah.
you. Sunil, there are a number of questions regarding the outdoor activities where there are few things is happening where we see that the kids, they're not going to school. Some of them who are blessed with the IT proper IT system, they're probably attending school from home, or many of them are being at home where they're not being very busy the way they were, the outdoor sports and outdoor activities. And also there are many people who are very active in different sports activities, let's say playing badmintons or cricket is very popular here, and also football. They are not really going out, or not having the opportunity to being together in one place. So in all this situation, from your point of view, when you've got lot many patients where you help them on the sports sides and all, I mean, what do you recommend? I mean, what they should be doing? Or even if they start, what should be the preventive measures that they should be taking?
I mean, you mean with regards to start playing sports during this time is what you mean?
Yeah. I mean, once things will be a little normal and people would like to play, right? I mean, they're missing their outdoor activities. We can see now the kids are very restless. What do you recommend that during this time when they couldn't start, what they should be doing? I mean, to be physically active, or and if they start in few months down the line, that what preventive measures they should be taking?
Yeah. So firstly, yeah, once things settle, probably it's a good time to start off. But it's very important to realize that if you have been very active for a period of time and then 6 months suddenly or 9 months, suddenly there's been no activity. So it's important to actually start off gradually. Otherwise, that's when you have these kind of sports injuries. So people who's wearing at the highest level and not played for 6 months, you can't go to that level where you stop suddenly. You're going to get a lot of sports injuries because of not doing certain activities like what we call, warming up. So there's something called as warm up, which you do before you start an activity, and cool down, which you do after the activity is ended. So whether it's running a marathon, whether it's playing football, sports, or any cricket or any sports, outdoor sports like that. So it's very important to, stretch yourself and, maintain the flexibility of your muscles. So that's the good thing, that even if you're not playing sport during this time, you can still be physically fit by, doing your stretches on a daily basis, so that when the time comes when to step outdoor, you're, actually be prepared for that. So that's one thing, is to do these warm-ups and cool down. Also make sure your activity is graded. You just can't start off to that level where you left. So you're definitely going to get injuries. So if someone who's actually running a marathon and is stopped, and then we advise them to start off again in short runs, say 5, 10 and half marathon, and then go to that full kind of activity to prevent these kind of sports injuries. So you have to be careful, but as you said, it needs to be restarted at the earliest.
Thank you. I mean, there is a question for Neha, where I think it's little intuitive. Uh, After Corona, we are hearing about a new flu-like virus spreading from animals in China, and some people have also died of this new virus. I mean, would you like to share if you have any insight on this particular issue? I mean, after Corona, there's a rumor about a flu or a new flu where the virus spreading from animals in China, and some people have also died. I mean, we are not too sure that's a rumor or it needs to be something which we need to believe or be careful.
Still published data has to come out on it. There have been several flus, several viruses which jump usually from animals to humans. Not everything can be, labeled as a pandemic creating organism. So still we need to know more. Yeah.
All right. And can you also share any tips about how to wash the clothes once somebody comes back home from outdoor? I mean, any particular tips?
So washing them with normal water and soap is sufficient. Uh, there's no need to add anything additional. If somebody is a healthcare worker and has healthcare, exposure, or somebody knows that they are dealing with people who have who are infected with COVID particularly, they can use little bit of bleach. That is, you can use one portion of bleach with 49% of water to make the solution and add it to the washing machine, or add it to the laundry which are you going to wash. That can be done, but then that is only indicated in case if there is a very evident exposure, or patient or the person is working in a high risk area. Otherwise, it's not necessary. Simple soap and water should be enough.
Thank you. I wouldn't be running it long, because pretty much the questions that I have received, it has already been covered during your presentation. Probably just two more questions. One is regarding the mental health, though I know that this is not the session about mental health, that we are all going out, we are attending the workplaces. Many of us have to work for 8 hours now. So once we are back home, a lot of time we are feeling that we might we might got infected, or we might infect our families as well. I mean, what should we be doing, I mean, in order to protect our mental health? I mean, any particular tips or suggestion from side? Anyone most?
I think Dr. Sunil very nicely told us in his first few slides about it. So exercise well, eat healthy, try isolating yourself, engage in a hobby. As he said, he actually elaborated it pretty well. Additionally, I just want to say that even if you get infected, there's no need to get traumatized about it. If somebody is having infection, just remember that most of the patients remain asymptomatic and do very well. They get out of the disease without having any complication at all. They can actually become fine with minimal most symptom and sometimes no symptom at all. So getting an infection should not make you think that, oh God, something is going to happen. You know, everything has collapsed. No need to think that way. If somebody gets an infection, okay, deal with it. There is treatment. There are doctors. There are people who are there to help you, and don't prioritize this over everything else. There is a lot of world beyond. There is a lot of things you can still do. Learn to live with it. It's going to be there. We have to take all the precaution and keep moving on in life. That is very important. Uh, I think, yeah.
I want to add one point here. I think, see, end of the day, it's a pandemic. I think all of us at some point of time will get infected to varying degrees. Pray God that you'll get mild infection and get the antibodies so that you don't die of it later in life. And it's better to get it along the line and have immunity which is inbuilt rather than dependent on vaccine that is going to come. That vaccine will come only in maybe next year sometime, maybe March to July onwards, but not in the recent times. So I think we have to accept that we are all going to get infected at some point of time to varying degree of severity. And earlier we accept, I think more that social taboo about it will disappear. Now it is like a big taboo that, oh, he is infected, that colony, that house has got the infection. I think it is very wrong. It is creating a panic. It's creating a psychological fear in people. It is just like any other flu. Only thing is we didn't know how to treat it, but we now know that 99% of people don't die of it. It is only that 1% that we are scared. Actually, the number of accidents is more than that 1%. The tuberculosis is more than the deaths that are caused by corona, but we are scared because it has been published like that by the media. There has been an environment which is, I don't know whether it is market driven or whether it is, there may be a lot of confounding factors, but definitely it is not as bad as we thought. A lot of us will go through it, and I am sure we'll live through it. Thank you.
Thank you. With this note, I'm going to close the session tonight. Just to reiterate the fact that Prime Bank has always been the forefront of during the COVID-19 disasters, where from the very beginning we took the right measures to safeguard our employees, our colleagues, and also we have made sure that our branches are properly disinfectant, to make it to keep offer a very secured environment for the customers who is walking in, and the way we have organized all this, it has helped us to earn the recognition of excellence in leadership during this time. So this Health Talk series is going to be we'll be bringing a lot more episodes and sessions. We'll be doing another sessions in Manipal Hospitals, in a few weeks down the line. And there are also a lot of planning uh, uh, to talk about, not only to talk about COVID, but we will continue discussing different issues, let's say the way we have done it tonight with spondylitis, back pain, sports injuries, and also about uh, how to protect from the infections. So, and tonight, I would like to close this session by thanking uh, our panelists. We had Dr. Neha Misra. Thank you so much for being here. I mean, it's great to hear from you. And I'd also like to thank Sunil, Kini for your presence. We know that you all are extremely busy, and you've managed time to come over. And Dr. Vidhyadhara for your excellent deliberation on talking about how to manage the posture, back pain, and a lot of myths that we do follow, that how to kind of take the preventive actions, not to go by the myth, and to be more careful about how to manage it by ourselves. So, and thank you very much for your presence. And I believe that our followers and also our colleagues who has joined with us tonight and watched us during the live streaming have been definitely greatly benefited from the session. There were a few requests that whether they would be receiving the presentations that you have shown here. We'll talk about it separately, but but our Facebook has been flooded by a lot of praises that how happy they are to hear from all of you. So thank you, everyone. And I would like to thank my team, brand communications team. I had Mr. Rahim with me today, Rakib from my communications team. I have our HR business partner, manager, Mr. Fida with me today to support me in this program, and the entire alliances, which has been managed by Zakaria from our consumer banking, consumer alliance team, who has been in touch with Mr. Ram Gopal from Manipal Hospitals to organize this session. I'm thanking all of them for offering us such a fantastic session tonight. Thank you, everyone. Good night.
Good night.